Hi, my name is Dr. Craig Parker and I'm joined by lovely Pam, and we're here today to demonstrate the assembly of the OxERA device as well as initiating therapy on a patient. The OxERA will come in a box like this. The only additional thing we recommend for setup is a syringe. Inside the box will be a mask, an anesthetic mask, the OxERA device, head straps, as well as instructions and a quick start menu. Please have a look at those, familiarize yourself with them. We won't be covering those in this video. The first thing is to ensure that our anesthetic mask cuff is adjusted correctly for the patient. This you will do by adding or subtracting air to the cuff. This one I've preset so that it's a snug fit on Pam's face. Next, check that your OxERA is assembled. It should look like this. It's the bag, the hose, the body, the filter, as well as the PEEP valve. Ensure that the PEEP valve is adjusted to one full turn less than 5 centimeters. That is essentially 0 PEEP. We adjust this by lining up the bottom of the cap with the 5 and then dialing it back 1 complete turn. Assembly is completed by connecting the anesthetic mask snugly to the device, ensuring that the pointed side is up. Your patient is likely to be on some kind of other therapy, and so you would switch across to your OxERA by simply changing the hoses. Pam, we're going to start on 10. You would start at higher rates if your patient was in severe respiratory distress, and then we're going to remove her old mask with Pam and ask the patient to hold that on her face and just to breathe comfortably. The next step is to attach the mask with straps. The straight strap is the one that goes at the bottom. It has little holes in it which attach onto this cage around the base of the neck onto a hose. Don't make it too tight. Keep it comfortable for the patient. This hose with a loop over the top goes on the back of the head. Again, it's easier to start on the other side of the face. Try and keep it central. And then one on the front. Ask the patient to let go. Pam, is that comfortable? You want to make sure the mask doesn't sag, but it's not too tight that it's suffocating and uncomfortable for the patient. How's that feeling? That's fine. Okay, good. Next we'll talk about optimizing therapy. There are two parameters that we can adjust on the OxERA. One is oxygen supply, and the second is the expiratory pressure in the form of PEEP or PEP. Oxygen supply is adjusted by turning up or down the volume, okay, to ensure that our patient is receiving adequate oxygen. Pam, we can see the mask, the bag inflating and deflating as she's breathing. The bag is not completely collapsing, and so she is getting all of her inspiratory needs met through the bag. The second is the PEEP value that is dialed in, and that we would adjust and increase in half a turn or 1 turn increments until the patient's saturations have improved to a point that we are happy with, while the patient is still remaining comfortable. If your patient requires above 10 centimeters of PEEP, please ensure that you have blood pressure monitoring in place to make sure that your cardiac output is not being compromised by higher PEEP levels. In another video, we will also talk about troubleshooting the mask and weaning the patient off the mask. You would need to then continually monitor your patient's condition by ensuring that their saturations are adequate, that their oxygen supply is adequate, and that the PEEP is adequate for their needs, and adjust it up or down depending on the clinical condition of your patient. So what do we do if our patient is not coping adequately on an OxERA and we feel like we have adjusted it optimally? The first thing is to check that you have actually adjusted it optimally. So have you got oxygen coming in at the maximum flow rate that your system can deliver? Are the connections correct? Is the patient not pinching the bag on their chest? Have we adjusted it correctly? Remember, these all swivel and can be adjusted so that the patient's more comfortable. This is particularly problematic in obese patients where perhaps their chin and chest are closer together. The second thing is the filter perhaps clogged? And that's easy to swap out, try a new filter, try it without the filter if you have to, but exclude that as a cause. And then is the PEEP valve correctly assembled? Has it been dropped and reassembled incorrectly? Make sure that is not a cause. Is there too much leak around the mask, that the mask is not fitting properly? So just do a quick system check to make sure that there's nothing structurally wrong with your system and that your oxygen supply is adequate. And then the next alternative from that is escalation in therapy. And we found that requires patients to be placed on quite a significant level of support to move from an OxERA up to potentially BiPAP. This escalation in therapy would likely be into an ICU type setting if that's available to you. Let's talk about weaning patients off an OxERA. Your patient has done well, their clinical condition has improved, their respiratory distress has come down, and we've noticed that their SATs have improved, as well as their respiratory rate is less. And now it's time to reduce them off an OxERA onto a lower form of oxygen therapy with the goal of sending them home. So the first thing to do is to reduce the PEEP. We found that has been the most effective way of weaning patients down, and there we would slowly reduce the PEEP down half a turn at a time over a number of hours until the patient was effectively back to 0 PEEP, which is 1 turn below the 5 centimeter mark. The next thing to do is to adjust the oxygen flow down to a point where the patient is receiving minimal oxygen supplies and perhaps even starting to supplement what they need in through the anti-asphyxiation valve. Most patients then will be very comfortably weaned down onto a non-rebreather mask or even onto a 40% Venturi mask or nasal prongs. Please have the OxERA handy as you do that, so that if they are not coping, you can put them back onto the OxERA straight away. Hello, my name is Dr. Craig Parker, and we're going to talk briefly about patient selection for the OxERA device. The OxERA device is intended for adult patients, especially those in the PEEP responsive phase of COVID-19 pneumonia. It needs to be used under the care of a suitably qualified and experienced healthcare provider, and patients need to have a normal level of consciousness and be cooperative with their therapy. Patients also need to be able to tolerate the snug-fitting mask, and the OxERA is particularly useful where only low-flow oxygen sources are available or where oxygen supplies are constrained. The OxERA is not intended for management of patients with impaired levels of consciousness or in patients who are actively vomiting. Patients also need to be monitored, so if monitoring is not possible, then the OxERA is contraindicated, and it is therefore not intended for home use unless it is under direct medical supervision. It also needs to not be used in environments where extended periods without oxygen supply are possible, or where a pneumothorax or bullous lung disease exists and an ICD has not been placed to manage the pneumothorax. Where a patient has facial abnormalities or facial trauma that prevent a snug fit for the mask, then the OxERA is also not going to function as intended. Please use the OxERA with care in patients with cardiac output impairment. The increased levels of PEEP might affect cardiac output, and so therefore cardiac output monitoring is vital in these patients. Please use the OxERA with care in unstable patients where management in a high care environment is preferable. Please see the instruction manual for more details.